When was body dysmorphic disorder first recognized? Imagine feeling distressed about your appearance so intensely that it affects your daily life. That's what body dysmorphic disorder is all about. Interestingly, this condition has a long history. It was first recognized in the late 1800s, with the earliest formal description credited to an Italian psychiatrist named Enrico Morselli. Around 1886 or 1891, Morselli introduced the term dysmorphophobia to describe people who were obsessively preoccupied with a perceived physical flaw. He observed that these individuals felt ugly or tormented over minor or imagined defects, even when others saw nothing wrong. This was a groundbreaking moment because it showed that concerns about appearance are not just superficial worries but can be serious psychological issues. Later in the early 20th century, other doctors mentioned similar ideas. Pierre Janet in 1903 talked about obsession with shame about the body, and Emil Kraepelin in 1909 called it dysmorphophobic syndrome. In Japan, some researchers referred to it as shubokyofu, which translates to fear of body deformity. Despite these early mentions, body dysmorphic disorder was not widely recognized in mainstream psychiatry for many years. It was often misunderstood or overlooked. It was not until 1980 that the American Psychiatric Association officially included body dysmorphic disorder in its diagnostic manual, called the Diagnostic and Statistical Manual of Mental Disorders. At first, it was seen as an unusual somatoform disorder, which means a mental health condition involving physical symptoms without a clear medical cause. Then, in 1987, the manual revised the diagnosis and officially named it body dysmorphic disorder. Over time, the understanding of BDD improved, and the criteria became more precise. The latest edition, DSM-5, published in 2013, placed BDD within the obsessive-compulsive spectrum, recognizing that it shares features with obsessive-compulsive disorder. It also introduced subtypes like muscle dysmorphia, which is a concern about being too small or not muscular enough. From a plastic surgery perspective, knowing when BDD was first recognized helps us understand its long-standing presence. Many patients with BDD seek cosmetic procedures to fix perceived flaws that are often not visible or are exaggerated. Recognizing BDD is essential because surgery rarely solves the underlying psychological issues. In fact, it can sometimes make things worse if the disorder is not identified. Ethical practice means carefully assessing each patient, understanding their mental health, and ensuring they get the right support. In summary, body dysmorphic disorder was first described in the late 1800s by Enrico Morselli, who called it dysmorphophobia. It was later formally included in psychiatric manuals in the late 20th century, evolving into the current understanding we have today. This history underscores the importance of a compassionate, informed approach when working with patients concerned about their appearance. Always remember to encourage individuals to seek professional mental health support for comprehensive care.